they got the instruction how to inhale. This is the system for inhalation. They put over their nose and their mouth, and it is necessary to a little practice how to inhale, exhale. You relax in this chair and you inhale through your nose as deeply as you can, and your stomach is going out or up. So inhale, keep your the breathing for a few seconds, and then exhale through your mouth, and your stomach is going back to your body. So it helps this kind of inhalation. It helps to the air to come down to the breathing tubes inside your lungs, completely down till the end of each bronchi, small bronchi, we call alveoli. It is like a small balloon where the oxygen is going from the lung to the blood, and from the blood stream carbon dioxide and other fluids come into the alveoli, and then we exhale outside. It is because it is not necessary for our body to keep the carbon dioxide in the blood. And usually the patient inhale for 10 minutes, then he relax 10 or 15. And then relax about 10 or 15 minutes. He can walk outside for a little while, and then he came to inhale another 10 or 15 minutes, but on another hive, because during the first inhalation the bees become tired, and the concentration of the bioactive substances in the air from the hive become different. The concentration of the very, very precious bioactive substances. So he changed the hive. It is a new one. The bees are ready, and they are working inside the hive, and they move their wings and produce this sweet and very, very nice smelling air that the patient inhale. Also, during the inhalation, the patient can hear the moving of the bees, and that sounds act very, very relaxing for each person.
What are the benefits medically of breathing beehive air, Dr. Zorica?
The benefits are always very, very positive to different kind of illnesses that the patient came for. On the first place, if the patient has some respiratory disturbance, like very often infection of the upper or lower respiratory system, then asthma, then chronic obstructive disease, but also, as I told you, all others, many others illnesses can be, the symptoms will be reduced using the beehive air, because these bioactive substances from the beehive air, they clean the respiratory tubes. Some of patients said after the inhalation, "Oh, come on, I'm coughing more often. I have a lot of sputum," and it is positive reaction, because the sputum become more liquid, not so consistent, but liquid, and the patient can cough it and outside of the bronchial system. And inside the bronchial system we have a very small cilia, like our hair, but you cannot see it by eyes. You can see it only under the microscope. And these cilia become not useful if you still have a lot of sputum inside the bronchial tubes. But when you clean it, these cilia become more active and help to clean the bronchial tubes. These bioactive substances also go through the tissue of bronchial tubes inside the bloodstream. So they have two kinds of effects, locally and through the bloodstream.
Would you like to see this kind of therapy used more widely in the world?
I think that it will be very interesting for all countries to organize as much as they can such small buildings, but they have to follow some advices. The building must be made by wood, and you cannot use some chemicals to protect the wood. It must be ecological chemicals. So also the windows must be protected from the bees from the outside, not to come inside. Also those who work with these systems, they also have the first aid, how to help patient if something, some allergic reaction, so the symptoms of some allergic reaction, or if some bees outside bite them, and they didn't know that they are allergic to bee venom. So when the patient came, we usually said, ask him about the allergy, especially for allergy to bee venom, because only bee venom can very quickly arise the allergy reaction of organism that is deadly for life.